much welcome all of you. This is, as you well know, a very special week. But maybe I should start by introducing myself. That's, I think it will be appropriate. I am Maria Neira, and I'm the director of the Department of Public Health and Environment at the World Health Organization. And definitely, I call myself from time to time, particularly when I am on a friendly environment, a pollution terminator. And I hope that at the end of this meeting, any one of you will have that title as well, and you will consider yourself a pollution terminator as well. Let me start on telling you why we need to be pollution terminators, all of us. And I'm sure you know this figure, and I'm sure that I will repeat in something that definitely is the reason why you are all here, and therefore you know it very well. But we need to keep using this dramatic figure. According to the World Health Organization and the statistics that we launch regularly, this is the dramatic figure that we are putting on the table of everyone who wants to hear it. 7 million premature deaths are occurring every year due to exposure to the bad quality of the air we breathe. How is that? I mean, we are giving this figure any time, any moment, any opportunity we have. We put it yesterday again on the table of the European Commission, the day before for European parliamentarians, this morning with a big meeting taking place in Canada, yesterday in Japan, at the World Health Assembly permanently, with youth, with non-youth, with policymakers, ministers, name it, G7, G20. I don't know what else do we need to do, but this continues to be one of the biggest public health challenges we are facing. So looking at your faces, you all look very young. So be aware that you have a major responsibility to keep with this major public health challenge, unless altogether we are able to do something that will change completely the drama that this represents. And we could do it. We could do it because there is no, there are plenty of reasons for hope, except the fact that we don't have enough political commitment to fight this. But there are several things we can do, and definitely will provide very good results. One is that, as you know, one of the main reasons why we are breathing this toxic air is because this pollution is caused by the combustion of fossil fuels. The combustion of fossil fuels is responsible as well for climate change, for the global warming that we are definitely confronting. And we have now a major opportunity anytime we go to the COPs, to the Conference of the Parties on Climate Change. We are bringing with us the argument that we are fighting pollution. So for us, for the public health community at large, anything we can do to mitigate the causes of climate change will be generating massive results in terms of public health. And one of those major outcomes generated by tackling climate change is the reduction on air pollution, and therefore the reduction or the contribution to reduce this terrible number of 7 million deaths caused by air pollution every year. So we need to take advantage of this big opportunity on the need to reduce emissions. We need to reduce emissions. We need to stop this nonsense of climate change, greenhouse gases, and pollutants, and start to present that as one of the major public health interventions we can have. The second opportunity and a major focus where we need to go for it is local governance, mayors. Many mayors around the world are now associating, recognizing that pollution levels in their cities is not giving them very good publicity. Now, many citizens, fortunately, they can measure, monitor themselves, the quality of the air they are breathing every day, and this is helping us to put some political pressure. Certainly, certain mayors recognize themselves that this is an issue, this is a big problem, and they are putting in place initiatives. that will require some political courage, but they are doing it. And then we can measure and monitor the health benefits that this is representing. So this local governance is giving us as well a big opportunity for addressing air pollution. Third, the multisectoriality. Until now, most of the issues when we talk at the World Health Assembly or in Global Health Alliance or fora is very much about diseases. And here we are talking about addressing the causes of those diseases, and pollution is one of the big causes of this problem. So therefore, this multisectoriality is more and more needed. Now, the health communities cannot just keep talking to the health communities. The health communities now, they need to speak the language of the ministers of energy, the ministers of industry, the ministers of finance and all of that. And air pollution, tackling air pollution is a very, very clear demonstration that this is the case. And of course, we need to involve the civil society. Unless our citizens understand that this is an issue, we will not be able to put pressure on our politicians. I'm receiving signals that I need to shut up, and I will do it immediately. I'm sure that many other very interesting things will be discussing, because I have very good panelists. But first of all, I'm very pleased to introduce Nathan Parnell, I think, is that okay, more or less? And he coordinates the work of the Scientific Advisory Panel on the Climate and Clean Air Coalition on UNEP, and a very good partner. So, Nathan, you have the floor, please. Come to the podium if you want, or if you prefer, you can stay there. Yeah, go ahead.
Hopefully this thing doesn't yell at me about shutting up. Brevity is not usually one of my strengths, so, but I will try to stick to my time. Thank you, Maria, and thanks to the organizers for inviting me here. Obviously, I am not your originally scheduled speaker. I am not Martina Otto, the head of the CCAC Secretariat. She sends her regards and deepest apologies for not being able to come here. It was unexpected travel to the other side of the world, preventing her from being here with us today. And I will hope to fill her shoes. I am yes, as Maria said, the Science Affairs Coordinator for the CCAC. I write all of our reports. For those of you who do not know about the Climate and Clean Air Coalition, we work at the intersection of climate change and air pollution. We were founded in 2012 specifically to break down the silos between the air pollution and climate communities and mobilize those communities together in tandem to work on projects and mitigate emissions from sources which cause both climate change and air pollution, leading to crippling burdens of disease and the 7 million deaths that per year that Maria mentioned. You know, when I was asked yesterday by Martina to step in for her, I was reflecting on what I should say, and the first thing I started reflecting on is how long many of us in the room have been doing this. I can't say I've been doing it. Yeah, there are people in here who've been doing it longer than me, but I've been doing this for almost 15 years, advocating that air pollution and climate change are functionally the same thing, and we can address them together if we really put our backs into it. Maria's been doing it longer than me. I said she's been one of the leading advocates in this space for a very long time. We've known that air pollution is deadly, and from a scientific standpoint, that it's connected to climate change for almost 3/4 of a century, if not longer. And given the fact that we've been working at this so long, it is a little bit disheartening that we don't have as much political commitment now to act, that as Maria was alluding to. I think we can easily say that now more than any other time in human history, there is a greater awareness of the impacts of air pollution, not enough, but at every level of society and government, there is a greater awareness, particularly among governments, about the connections between climate and air pollution, how they can be co-managed. But given all of this, I thought to myself yesterday, you know, how do I accurately and correctly state that this is a moment in which we need to come together to support civil society, the public health community, and governments to truly act, to capture a moment, given how long we've been doing this together. And I have to say, I do really think that there is a particular moment that justifies us being in this room, getting excited to work together to drive policy change. Maria mentioned that there's an enormous amount of interest at the municipal and local level. There's civil society. Even many national governments are taking more and more action on air pollution and climate change. But I want to actually highlight something else that's above the national level. Now, for the first time ever, every country on Earth is part of a regional agreement to cooperate on transboundary air pollution. These are agreements that have grown almost entirely organically from the grassroots, but every country now, every region in the world has a regional transboundary air pollution cooperation agreement. There is greater recognition at a political level that countries need to cooperate now to co-manage air pollution. And this is in places that we didn't think was possible even a couple of years ago. There's a new air pollution cooperation agreement in the Asia Pacific that covers the entire region. It was passed last December. The long-range transboundary air pollution agreement, the Gold Star transboundary air pollution agreement that covers Europe and North America, has launched the FICAP program last year with the ambition of working with other regions to support their additional ambition. There's a revitalized regional agreement in Latin America. There's a revitalized regional cooperation agreement in Central America and the Caribbean. Every economic region in Africa has got a cooperation agreement. The Mali agreement in South Asia is being revitalized. The EANet agreement in North Asia is being revitalized, and the focus is being placed much more on air quality. All of these agreements exist. They are being revitalized. There is more political energy in that space now than at any other time in our recent history. There are many unifying factors between these regional agreements, but one unifying factor among all of them is they don't have enough resources to support their ambition. That's always been true for air pollution, I think. But and I'm not just talking about money. Of course, money is important. Resources to act is incredibly important. Cooperation takes time. It takes human beings. It takes technology. But there is a political moment right now, and political moments, they come not too frequently in this world, and they can pass just as easily. Budgets get shifted, attentions shift. There's a moment right now that we could capture right now to invest in ourselves, invest at every level of government, but particularly invest at regional cooperation to support ambition on air pollution mitigation connected to climate change. And that's why the Climate and Clean Air Coalition, yeah, okay. Elaine's yelling at me. I gotta pivot to what I'm actually supposed to talk about really quickly. This is the moment, guys. Next year is probably as long as we can expect for the political momentum to continue to be there, and we need to capture it. We cannot afford to let this thing go by. So the Climate and Clean Air Coalition, as I said, this is what we do. We put together climate and clean air, advocate with countries, build their capacity to really co-manage these issues, support civil society in countries. For example, Cameroon is a new member of the Climate and Clean Air Coalition. We're working to help them build their capacity to co-manage air pollution and climate. We partner more closely, I think, than almost any of our other partners with the World Health Organization, and we've stood shoulder to shoulder on all of the successes that we've had over the last couple of years. But to really support this ambition and hopefully capture this moment, we're launching, hopefully at COP28, our air pollution flagship in the CCAC, which is a short-term, it'll be a 2-year flagship designed to really elevate this issue, support our partners to take more action that includes civil society groups, focusing as well on advocating and activating the public health community so they can support raising ambition and in particular support mobilizing the resources so that we can finally start investing in ourselves in a way that actually achieves the ambitions that we've placed before us to clean our air and to prevent catastrophic climate change in our lifetimes. So thank you very much for your time.
Thank you so much, Nathan. Thank you. Thank you. You know, it's lovely to be the moderator when you have the nasty one sitting in the first row, reminding people about timing, and not me. So I'm the good cop here. Fantastic. It is a great pleasure now to give the floor to Dr. Camilla Kingdon. She's the president of the Royal Society for Pediatrician and Child Health. And I have the privilege to be recently with you. So over to you, Dr. Kingdon. Tell us about why it's so important for children's health to have cleaner air. I hope you are with us. I don't see you moving in the last few seconds. Oh, it's a video. Sorry. That's why she was... Yeah, it was right. She doesn't move.
My name is Camilla Kingdon. I'm a paediatrician working in London, and I'm president of the Royal College of Paediatrics and Child Health. And I want to talk to you about air pollution and make the case for why this matters to each and every one of us as citizens of the world, but why it's a critical issue for children across the planet. In the UK, air pollution is now the largest environmental risk to public health, and children are particularly vulnerable. Globally, more than 90% of children are exposed to PM 2.5 levels that exceed 10 micrograms per cubic meter. And air pollution is linked to 16% of all deaths in children under 5 years of age. And this burden of exposure is unevenly and unfairly shared across the world, with those in countries that have contributed the least to the problem affected the most. Now, the impact on children starts long before they're born. There is a rapidly developing evidence base about the impact on pregnancy. There's now plenty of evidence to link air pollution with infertility, miscarriage, prematurity, and intrauterine growth restriction. A study published just last month by teams at King's College and Imperial College London showed that air pollution directly impacts the development of the newborn brain in a negative way. Now, after birth, babies and children are much more vulnerable to air pollution than adults. Children breathe faster, so they inhale more airborne toxins in proportion to their weight. And their organs and immune systems are still developing, so toxin-induced damage is far more likely to have an impact. And we know that children with asthma are much more likely to have recurrent exacerbations if they're exposed to fine particulate matter in polluted indoor and outdoor air. Now, air pollution is increasingly being shown to impact every organ system in the developing child. Poor air quality has a negative influence on memory development in children and also hinders the ability to reason and problem solve in a fascinating study looking at cognitive function in children in a number of cities in Africa. Just 2 months ago, another study from King's College London showed that exposure to PM 2.5 particles during adolescence had a significant impact on systolic blood pressure, especially in girls, in a large study of over 3,000 teenagers living in London. Finally, there is now evidence that there's a critical link between air pollution and both poverty and race. If you grow up in poverty, you're much more likely to be exposed to poor air quality. And in a study last month from Harvard, researchers were able to confirm the link between air pollution causing death and poverty, but found critically that being Black had a far greater negative impact, thus confirming the link with race. So I hope I've convinced you that this is not a trivial issue. People are now referring to air pollution as the silent pandemic. It's already the second greatest cause of death in Africa after HIV/AIDS. We need to approach this as an emerging global health emergency. Thank you.
Thank you. Thank you very much. Anyone not convinced? Should we pass the video again? No, you are all convinced. I mean, there is a very strong argument. We thank you very much, Dr. Kingdon, even if she cannot hear us. It was very, very passionate and definitely yet one other global public health challenge in front of us. It is my pleasure now to invite the civil society to intervene. And the first one will be, and I think it will be a video as well, but a good friend, once again, Tolua Oni. She is from the University of Cambridge, and she leads this group of Urban Better project, among many other things. But Tolua will tell us about what the situation in Africa and the many sources, new sources of pollution. So, oh, you are live, super. So happy to see you, Tolua.
Lovely to see you.
I was wondering, an static video message, and I say she will miss, you know, her energy and all of that. We cannot miss that. Over to you, dear. Very happy to have you with us.
Great, thank you. It's a pleasure to be here, as it were. I hope you can see my 2 seconds. My slide, okay? Can you see my slide, okay?
Yes, we can see it.
Okay, fantastic. Well, sorry I can't be there in person. I will be sharing on behalf of our citizens our approach to what we call precision activism for clean air and healthier public spaces, and that will all become clear in a moment. So what is the context here? A little bit of a rationale. I'll give you a little bit of a background, give you how we got to this idea for the Citizens Endeavour, and I'll tell you more about it, or they will tell you, in fact. The context we're dealing with here is that we have Agenda 2063 from the African Union, which sounds like a long way away, but is only 40 years now. It does include health and well-being and inclusive, sustainable cities, but actually how we get there is not clear. But what we do know is that how we're urbanizing at the moment is certainly not aligned for those goals. So we ask, what if access to health enabling, climate resilient environments in cities was a central guiding principle of all urban development? And what if the majority demographic led the way in shaping these cities for health? Now, I say majority demographic, not youth, because on the African continent, the median age is 19. So we are talking about the majority of people. And so I established Urban Better, which is essentially an urban health practice, learning, collaborative and active advocacy platform. And what we do is connect, mobilize individuals, communities and organizations to future-proof health and health-proof the future of our cities. And fundamentally, we are science-based, equity-centered, Africa-led and youth privileged. So when we're talking about rethinking and reshaping our cities for health, what do we mean? We're actually thinking differently about health infrastructure. So we're at the World Health Assembly this week, and we normally think about health infrastructure and health systems in the context of the 6 building blocks. We have a slightly different approach. So say, okay, how do we think about urban infrastructure as critical health infrastructure? And so we work through the air we breathe, our places and spaces, and the food we eat as 3 critical pathways through which we can create health in the context of climate vulnerability. And you can see how the air we breathe in terms of air quality, which is the focus, largely the focus of this session, plays that role. So we talk about the air we breathe, our places, spaces, and the food we eat, are 3 elements of public space, right? Because public space we know is critical to equity. But there is a 4th element of public space that is really critical, which is our civic space. And so when I tell you a little bit about the citizens, you'll see how this civic space really comes to bear in our approaches to improve the air we breathe. In terms of our theory of changing the pathways through which we do that, I like little mnemonics. So we talk about aspire, inspire, conspire, because in order to effect this change, this is a monumental kind of transformative systems approach. But we see it is critical to firstly aspire. So we have to build the world. We can't create worlds that we cannot imagine. So how can we shape new norms to build these new worlds that we want to inhabit? Inspire speaks to the information that we create. So how can we create evidence that we can use to tailor advocacy to inform decision making and really push the boundaries of how we generate evidence and how we train the next generation of planetary health researchers and practitioners. And lastly, because we cannot do this alone, conspire, because we need a vibrant community and network of people across the continent and globally to be mobilized, equipped, and connected to effect this change. So you will see this repeat as I go along, so look out for that. So the Citizens Initiative is our flagship initiative of Urban Better, and this is Citizen Science for Planetary Health. So I'm going to give you an example of Citizens for Clean Air to show how the majority demographic are aspiring, inspiring, and conspiring to make the urban better. So air pollution. We heard from Dr. Kingdon earlier and the first speaker about how air pollution is now the second largest cause of death on the continent. Importantly, there's been some progress made on air pollution. A lot of that has been indoor air pollution, as you can see with the graph on the left. But the outdoor air pollution is still significantly lagging behind. So there is a lot of, we just even haven't started touching the sides yet. And yet, only a fraction, so 6% of children on the continent reside within 50 kilometers of air pollution monitoring stations. So how can we change what we're not even measuring? This is what we need to tackle. This is a report that from the Clean Air Fund, from Pollution to Solution, which is an excellent piece of work if you haven't come across it, looking at the cost. Because often in the context of resource constraints, we always ask, can we do this? Can we afford to do this? This is showing us that we absolutely cannot afford not to do this. So this is the cost of air pollution in Lagos and Cairo. But to put it into words we understand, in Accra, the number of deaths that are attributed to air pollution is 3,000 in 2019. And this was more than the premature deaths from malaria, from tuberculosis, from HIV. Similarly, and a similar pattern that we see in Lagos, much more than malaria, much more than HIV. So, and the vast majority of this, so the World Bank report recently in Lagos found that over 50% of these premature deaths from air pollution are in under fives, which really underscores the point that Dr. Kingdon made earlier. So that's air pollution. I'm getting you to the citizens now, because in the same cities that are rapidly urbanizing in this way, we're also seeing an epidemiological transition. We're seeing a shift from largely infectious to largely non-communicable diseases. We're seeing a rise in obesity, a rise in diabetes, a rise in high blood pressure, and we're seeing a rise in the behavioral risk factors that we know drive these diseases. Physical activity is one of them, right? We know that this is an important behavior for health, and particularly even though they're different domains of physical activity, we know that leisure physical activity has additional benefits, both for physical and mental well-being. But in the same cities, we're seeing that physical activity is not something that is supported, right? So this spider diagram is really just to show that when we talk about physical activity, we're often very happy to talk about all the things that people are doing that they shouldn't be doing. But what we spend a lot less time on is looking at the built environment that needs to support, but is currently largely poorly optimized for this. And so we really need to start thinking about moving from individual awareness to supportive environment, and particularly on the young continent. So why on a continent where 75% of people are under the age of 30, are we talking about health in the context of disease? Should we not be saying, okay, we're resource limited, let's throw our resources to ensure that we preserve the health of this young population for as long as possible? This is where public health infrastructure we start challenging. So I should have started by saying it's Africa Day today. So happy Africa Day. And I am at Future Africa at the moment, which is a transdisciplinary platform in Pretoria, in South Africa. And this was me on a run this morning, right? This is my happy place, as you can see, running in the outdoors, in public space. This is the scenery from Pretoria, right? It is from Future Africa. This is my run this morning. Really stunning sunset. You know, you see green space, lots of open space, really fantastic. Interestingly, you know, this is the air pollution. This is the air quality levels this morning. Also, pretty wonderful, right? How lucky am I? So I run a lot and I travel a lot, and I run wherever I go. And this is where it came from. I started noticing that in different cities across the world had different experiences of running, right? So whether it was how easy it was to walk in terms of the built environment or the quality of air. And even within cities, I could run without knowing the city. I could keep running. Okay, I think we're probably in a wealthy area now because the air feels a bit better. There are more trees, etc. Why is that? Why is that? Why could that be normal? Why should that be normal? So that's where the idea started. We started thinking, well, how can we merge these ideas of looking at embracing a behavior that we want more of, and that is already happening, but actually for a lot of people, they're undertaking this physical activity in public space in often precarious and health damaging ways. So how can we start thinking about integrating NCD prevention and climate action? And air pollution is a critical opportunity there. So I'll take a side step back there and then just show you a little bit more rationale, and then we'll dive straight into it. So there was this landscape analysis that was done in a couple of years ago that looked at young people's engagement in climate change and health in different contexts in Africa and Asia. And one of the interesting things that they found was that there was just a lot of focus on well, firstly, there was a lot of siloing. So siloing in terms of climate advocacy over here, health advocacy over here, never the twain shall meet. There was a lack of multi-sectoral policies for integrated action for health and climate. The institutional mechanisms were very non-inclusive. The policy processes were inaccessible. Where young people were considered, they were considered as passive victims. So, and then we've already fallen to that extent. Okay, they're really important. They're passive victims. They're vulnerable populations, but they rarely engage with them as actual enablers and people that could actually be part of the solution. And any mention of them was very detailed. So that's one thing. The other thing that was notable in the same year was this commission on governing health futures. And one of the striking things from this commission was that it identified a need to refocus digital solutions on long-term health prevention and to develop frameworks for meaningful youth engagement in digital health interventions to promote equitable, affordable, and universal access to health. Health, not just healthcare, health. So we started asking, how can we leverage this pre-existing engagement of young people in climate advocacy and health advocacy to generate evidence that we need for this integrated action? How can we support pathways for youth engagement in urban and health decision making? And how can we generate the kind of dynamic evidence we need to inform and shape our cities for health? And really that boils down to how can we increase the demand for healthy public place, and how can we increase the supply of health from place? So the Citizens for Clean Air initiative, I'll spend the rest of the time talking about. And going back to our model earlier, it really cuts across that intersection of the air we breathe in our places and spaces and a cross-cutting element of our civic space. What did we do? In Lagos, Nigeria, Accra, Ghana, and Cape Town, South Africa, we put a call out and majority demographic sample applied to be part of this initiative. We and this is what this is them in the 3 cities. Before I say any more, I'll let you meet them.
Good day. My name is Masilo, and I'm grown leader of science. Hi there. My name is Patience NT.
My name is Kiara.
My name is Onome.
My name is Lisha Savisa.
My name is Michael Dafa.
My name is Luma Kwan.
My name is Ruby.
Hi, my name is Wazri Benasara Wakar.
Hello, my name is Nell Bensel.
Hello, my name is Ron Cosma.
And my name is Miriam Bolan.
Hi, Michelle.
Hello, my name is Sani Kuman.
My name is Pupilo Banshine.
Okay. So that was some. Oh, sorry. Next.
Pretty.
Okay, so that's what we did. So that was a sample of them. We got them together. They looked at, well, what are the key issues that are affecting the air we breathe in our public space and how we move and navigate with these spaces. They then started with the world building, right? So what is the city we want? What does a city with clean air and runnable spaces look like? So this was them kind of starting to aspire and shaping the worlds that they wanted. We then equipped them with wearable air quality sensors. We equipped them also with kind of advocacy skills and mobilizing skills. So for each one of them, they mobilized their peers and designed their running routes, and they ran through their city with the air quality sensor and with an app that we designed to capture photo, video, audio data that are geolocated to understand, well, what sort of sources of health risks, sources of air pollution they encountered on the way. This is what they look like. This is Lunga in Kailicha. And he's actually a professional athlete, and he came to this because, you know, we know that air pollution impacts the performance of elite athletes. So we've integrated the data from the sensors and from the app, and then so they could start to see, well, okay, how do we understand the context of what we see? How do we understand we see good air here, or what are the features in the environment? We see highly polluted air here. What are the characters of the environment that we see? So this is the inspire part, right? So we're starting to generate those data stories to tailor advocacy. They also found, so let me tell you a little bit about what they found in terms of the sources of air pollution.
Yaba is a very busy area because of the amount of vehicles that is. And the major causes of air pollution in Yaba is toxic emission vehicles.
The main issue with pollution is definitely the amount of car traffic around.
The main cause of air pollution in my area is wood burning, fire emissions, landfill.
The major source of reduction in air quality in my neighborhood is from car exhaust, especially during the rush hours, so in the mornings and in the evenings.
The main source of air pollution in my area is probably cars, buses, and taxis.
The main cause of pollution in my area is gutters, burning of refuse, and then releasing of fumes from exhaust pipes into the air.
The main cause of air pollution in my area is from vehicles.
The major activity is sound, which is what we put as part of this pressure of sound, the temperature in the area is very, very high. Most of the carrying sound areas of construction.
The main cause of air pollution in my area is burning of refuse. And if I should say there's any cause of air pollution around my area, it should be those folks from we don't have legal cities. So,
and the major causes of the air pollution in that environment is more of transportation and open burning and generator fumes.
And some of the main causes of air pollution in Lagos, one of them is industrial waste.
So many sources of pollution in my environment, some of which include open burning of waste and open cooking, using charcoal, firewood, waters. And you also have exhaust fumes from mostly generators and sometimes cars, Okadas, tricycles. And you also have cases of poor waste management and sanitation in some areas in Surulere.
So you can start to see the data stories that they're generating and how that's informing. So we brought them back together, and we printed out and integrated the data that they collected, and then they started looking at those to say, okay, what do we see as where is air pollution best in the city? Where is it worst? What are the contexts in the environment that we see shape that? And they use those data stories to generate messaging, key messaging that they used to then remobilize their peers using the messages that they designed based on the data, and conduct runs again that get into pushing towards increasing that demand for clean air. And you can see how that connects with both Inspire and Conspire, really trying to build this community. They, in addition to that remobilizing, one person from each city was at the COP27. They had an exhibit on the Youth Day and the Science Day. They had a social media activation using the photos from all the different runs that got Clean Air COP27 viral. And in the month before leading up to COP27, reached almost 2 million people. They had They had an exhibit at COP27. They presented the Youth Pavilion, actually organized a run and collected data from the air quality to see what the air quality in Sharm el-Sheikh was, and presented those data along with the photos of and largely it was kind of construction areas that we saw in Sharm. So not only that, but they also developed what we call policy prescriptions, using the data to say, this is what we see as critical, and this is how we need to be part of the solutions. And those were captured in that report there. It got a lot of pickup from the media because, again, in terms of increasing the demand, we need to make sure that we're mainstreaming this message. And this is Waziri who ran after this in January and measured air quality using the same technique whilst running the Lagos Marathon. So really, you can see how cross-cutting these majority demographic across the continent is starting to aspire, inspire, and conspire for clean air and for healthier cities. And what we're doing really is mainstreaming this evidence into activism and looking at how we can shape and create space for inclusive participation into governance for clean air and healthy populations. So we've got these citizen hubs that are developing in the cities, scaling this participatory infrastructure, and we've got a few demonstration projects happening, and really critically working closely with the city government to really looking at how we can, beyond projects that we do, institutionalizing these mechanisms into their air quality management systems, and really critically looking at how these impact the individuals, the collective, and the city, in order to ensure that we are collectively aspiring, inspiring, and conspiring for clean air and for healthier populations. So with that, I'll end. Thank you.
Thank you. Thank you very much, Dr. Omi Tolula. A great pleasure. I was very much waiting for the last part on the conspire. I wanted to see what it was under conspire, but this is very inspiring. Thank you very much for all the work you are doing. We are all very jealous about you going around in beautiful places in Africa, and happy African Day. Lovely to see you again. Let me keep now with another representative of the civil society. We have with us Mr. Elvis Ndikun, who is the coordinator of the Global Youth for Clean Air and Climate Health Action. And I think he will tell us about Cameroon, correct? Go ahead.
Thank you very much.
You want to move there?
Yeah.
Please.
I'll do it there and here a little bit.
Whatever you prefer.
Yeah. Thank you very much for inviting me to speak here. I'll just continue from where Tolalo, we have spoken. I've seen her work from different media, really virtually, but not physical. One thing I want us to know is that we are actually facing an issue which is bigger than the way we think. And in my 7 minutes, I really thought about bringing us to action, because I've been working on air pollution and health for the past 8 years. And something I noticed is that we are far from facing the problem the way it is. I'll just warn you people, I know we have been sitting, but I'll do something which is really unusual, which symbolizes what, during my work and what motivated me maybe around 2014, 2015 to keep doing this work. There is this little story. My work really began around making the link between evidence and advocacy and policy change and raising awareness using evidence. And during my work, I don't know if any of you know anybody personally who has passed away from either asthma, respiratory condition, or cardiovascular. Maybe in your work. As an advocate and civil society activist, this is something which was different because when you speak to people without meeting those who pass away because of what you're fighting for, it's always different. I always promise myself to do this when I'll get to the stage to speak to influential people, because I know everybody here is very influential. Because for me to be here, it has taken like a long journey. I want us to stand up. It will be a minute of silence to all those who have died. I know this teacher who passed away. When I came collecting data on asthma, he was an asthmatic, but he never told me. 1 year after, when I was collecting my data, when I came back to the school, he passed away. When I asked what was the reason, they told me it was asthma. I felt really bad. And I went back in my family, and I discovered my grandfather was asthmatic. So we have a history of asthma. And it's something which, when we make the experience between the patient story and the reality of the disease, the cause, the risk factor, then we begin feeling differently what is happening. I just want to give, not to only this teacher, but all the other people, the 7 million people who have passed away, this minute of silence, which when we stand up and sit back, it will not be to wake up the same way we came here. It will just be 1 minute. I'll be happy if you can do that for me. Please. Yeah, I know we have been sitting just 1 minute. It's part of my talk. I won't go without giving them the 1 minute. Thank you very much. You can sit down. I'm so grateful for doing this. It's when you know those who have passed away. My talk today is going to really raise the profile for air pollution on the work I've been doing with colleagues back in Cameroon, which has been at country level. When I began air pollution, it was more about really focusing on the evidence. And the evidence I read, the first time I read about air pollution was in India during the Global Youth Meet. It's a conference, Hyrie Day Public Health Foundation, they usually organize every like 3 years. I was fortunate to be invited in 2014. Then we attended in 2015 because of the climate crisis. Visakhapatnam, which is in the south of India, which was hosting the event, had this hurricane, so the hotel was destroyed. So because of climate change, we had to attend the next year. The hotel had to be rebuilt. And during this conference, I actually read air pollution was killing 7 million people. And I was like, what is happening? And this was just after I came back from the World Conference on Tobacco or Health. I saw asthma had no disease, no cure. Like people who live with asthma, it doesn't have a cure. You have just preventive measures. So I decided to collect data on this. Unfortunately, Global Asthma Network gave me this privilege to be the principal investigator for Yaoundé. And since 2015, I've been working on this, and we succeeded in collecting the first global data on the prevalence of asthma in Yaoundé, which is representing Cameroon, because actually what happens is that we collect data through schools. It's a community survey where we use passive consent to get into schools, and we collect data on children 6, 7 years, 13, 14, and the adults. And I'll just give you a brief of the results from this survey we did. What actually happened is that asthma was more prevalent amongst adolescents. The percentage was 5.3, and in children 6, 7 years, it was 1.8, and in adults, it was 3.0. if you listen and you understand, like, you can see the difference. Why is it higher amongst adolescents? We know, for those who are medics, asthma is genetic and causal. And what actually happens is that the only reason why asthma was small amongst children was that it's genetic. And once they grow up at age 13, 14, it starts developing. And one thing which was staggering in our results was that smoking tobacco is always known as the most prevalent or the most evident cause of asthma or exacerbating asthma. But what we noticed is that the prevalence of tobacco smoking was really low amongst children in our age group, like those adolescents. But the risk factor, which was really profound, that we could use to confirm that it was responsible for the asthma, the increasing of asthma in adolescents and really decreasing in adults, was air pollution was one of them. Because when we went in our survey, we noticed that in the homes, most of the parents still use fossil fuel for cooking. 70%, they still use firewood for cooking. When we go in, still in our study, we noticed that most of, like 40% of the children, they live in homes which were highly polluting vehicles. So we have high trucks and dust from unpaved roads. So these were indicators that made us to know that air pollution was a big problem. And since we noticed this, we decided to go into school. I actually, nationally, I run a youth organization called Association for the Promotion of Youth Leadership, Advocacy, and Volunteerism. So we had, at its creation, the vision was the promotion of peace and eradication of poverty. So what actually happened is that when we identified air pollution as a big problem, we started bringing solutions. And thanks to a training with the World Organization of Family Doctors, WONCA, I was selected as a trainer. We did a training for 1 year in 2019, where we got a collaboration with the Ministry of Health to train in schools. So what we did is that we used the evidence from this survey, from this asthma survey, to now get into schools and train students. And we had 2 schools that were piloted. And what was very funny about our study, our campaign, and our training and activities is that what? There is something about fossil fuel. It's considered cultural. Like when we talk about air pollution and we talk about burning fuel, it's not the way the community doesn't see it the way we think. It's something where people have been burning for years. And when I told the principal, we are going to advise, train the children, to train their parents, to advise their parents in a form of training to stop burning firewood, he was first of all surprised. Like, this is not something you can tell the students. But when we put the package of how air pollution is linked to respiratory and cardiovascular disease, because the children grow up with developing lungs, it is much evident that their lungs will have low lung function, and it will be preparing them for cardiovascular infections in the future. So the children, once they keep inhaling pollution, and one thing which is very hidden about air pollution is that, especially in Cameroon and maybe everywhere, most of the air pollution indoors doesn't come from indoor. It comes from outdoor. For example, in Cameroon, it's not like all the homes were in Yaoundé that they burn firewood, but there is so much of waste burning happening outside the homes, which even in the dust bin, most is being burned. So this is the major, when we talk about air pollution in Cameroon and low and middle income countries, is about waste management, because this is a big problem in Cameroon. So what actually happens is that all these sources of pollution, they get into the room, into the homes, and in our context, we have what we call carpet. So if you see this is something where they put in homes, and it's really like for prestige. But because children who are less than 5, they creep on the floor, they inhale all the dust and the pollution that comes and settles in. And from my study, when I was collecting data in schools, parents would come up to me, teachers and parents would thank me that actually you advised us to remove the carpet, and now I don't take my child every day to the hospital. So these are some of the issues that we took into consideration, like practices. And also one of the practices we did for air pollution in particular indoors was that we asked the children, if your parent cannot afford clean energy, when they are cooking indoors, can you stay out? Can you advise them to take their kitchen out of the home and burn it out? So this was something that was really interesting. And to culminate everything that we did, we had a really interesting project with the Global Action Plan UK, where we mobilized for clean air to be included in the United Nations Convention on the Rights of the Child. My organization was one of the ones. We had just 5 countries, the UK, US, China, Cameroon, and India, that participated in this campaign. It's called the Freedom to Build campaign. It's still going on, and for the first time in history, clean air was included in the United Nations Convention on the Rights of the Child, thanks to this advocacy that we have been doing since 2021. And we are hopeful that in June, tomorrow, it will be adopted officially, that clean air has been included in the United Nations Convention on the Rights of the Child. So this has been like one of our biggest advocacy, and we are looking forward to it to really change the pace for clean air. Because if we clean air for children, we clean air for everybody. Thank you so much.
Thank you. Thank you very much. Thank you very much. You see that when it's about advocacy, we have very good leaders mobilizing all of us and definitely putting not only data and evidence, but passion as well on what they do. Let's move to another important advocate and describing the youth, what the civil society is doing. Dr. Adriana Mbandi, leading the UN High-Level Climate Champions Partnership. Where is Dr. Adriana? Hello. Welcome.
Good afternoon, good morning, good evening. Okay, shall I proceed?
Please go ahead. Yes, thank you.
Thank you very much. So I am actually heartened to hear that waste has been mentioned several times this afternoon. It's mentioned several times because open waste burning contributes significantly to air pollution and climate change. It is impacting...
Can I ask you, sorry to interrupt, please increase a little bit your volume. We see you, you are very powerful on your presentation, but it will be great if you can, you know, a little bit more volume.
Okay, can you hear me now?
Yes, very well.
Thank you. So I was in the process of explaining that open waste burning contributes significantly to air pollution and climate change. It impacts livelihoods, the safety of people that deal with the waste. It also impacts health. And there's a reason why we look at open waste burning in Africa, even if this is a practice that is found globally. 90% of the continent most likely openly dumps their waste or burns, which most likely ends up being burned. Waste contributes about 5 to 12% of greenhouse gases, contributes about 20% of methane globally, 11% of black carbon, and open waste burning contributes about 29% of fine particulate matter. So just to show you the linkage between waste, air pollution, and climate change. Now, to go back and how all this fits together. So rather than looking at only Kenya, I look at the continent and try to show how you can scale up and multiply actions with civil society. So at COP27, we launched a multi-stakeholder partnership to eliminate open waste burning. Now, this partnership was launched by the president of AMCEN. AMCEN is the African Ministerial Conference for Environment. Now, this was co-hosted by UCLG, United Council for Local Government, so all local governments in Africa, then Engineering X, which is an initiative of Lloyd's Register Foundation and Royal Academy of Engineering, and United Nations High-Level Climate Champions, who are represented here today. The high-level champions bring together state and non-state actors, so government and non-government actors, which crucially also includes the civil society. When you look at the high-level champions, you're looking at over 11,000 non-state actors. This also includes civil societies. Now, before we go to COP, we had all African ministers pledging to eliminate open waste burning in Africa by the year 2040. But more than pledges, because we know sometimes how pledges turn out, they actually also put it forward that we should have a vehicle on how we are going to realize the elimination of open waste burning in Africa by the year 2040. Now, this initiative was initiated in 2021 to enhance awareness on open waste burning, build a community of practice that puts at the center youth, women, children, vulnerable members of our society, put together all as a civil society action, and then also find ways to include waste in the net zero pledges and actions that were taking place, and ensure that it's included in consideration for climate resilience and adaptation. Now, underpinning all this was a global scanning exercise that produced the knowledge to show that there is indeed a challenge for open waste banning. Now, let me go back again to the partnership and the outreach that you've conducted from the onset. Now, if you know anything about waste in Africa and a lot of developing regions, you will understand that the informal sector provides waste services and provides almost all waste management on the continent. That means if you're looking at waste, curbing waste mismanagement, you need to look at women, youth, and vulnerable groups. So it makes sense to have the multi-stakeholder partnership consider this as critical members of the partnership. Now, to do this, over the time that we've had to work on this from 2021, we've had outreach to youth, societies, and affiliations. We've had journalists, webinars that look at reaching a wider audience on how to critically pass this message of eliminating open waste banning. But also we have co-hosted platforms with NGOs, CSOs on the continent. But you'll also understand on the continent, small to medium-sized enterprises is often how some of the formalization on waste management happens. So moving from informal sector or trying to transition from informal sector, you often find the continent has a lot of small to medium-sized enterprises that are involved in waste management. So also working very much so with the small to medium-sized enterprises. And of course, ensuring that from the onset, there is inclusion to the multi-stakeholder partnership of all these different groups. Now, before I come to the end, what I want to say to you is that when we look at the continent, we often define the problem on waste management or waste mismanagement as a pollution challenge. But I think it has been said before by other speakers, more than defining a challenge is presenting the innovative solutions that are already on the continent. And in doing so, on open waste banning, we look at 4 pillars that civil society get engaged and work with us. So for the very first pillar is to look at the institutional frameworks. Now, this is the governance frameworks. Almost nearly all laws, standards, and regulations state that we need to have public participation. But how is this carried out? Are these civil societies included from the beginning? This is a question we pose within the multi-stakeholder partnership. The second one is financial. I think it has also been stated by a previous speaker. If we do not have, and I think it was Hugh Nathan, if we do not have the finances that are dedicated to curbing air pollution, acting on a critical sector like waste management, then we will still be talking about the problem, as Talula has reminded us, in 2063. Then there is infrastructure. There's a big gap. Most of our infrastructure, both in urban and rural areas, and especially looking at urban centers, that infrastructure was built for maybe 10% of the population that inhabits those cities, municipalities, and local governments. So how can we critically bridge that gap? But at the heart of it, understanding that civil society needs to have a say for this. It's often quite difficult because when you look at civil societies in Africa and you look at the work they're conducting, it is almost seen as it's not formalized and therefore a challenge to deal with in terms of infrastructure and finance. However, small to medium-sized enterprises, as well as savings and cooperatives, which are informal ways of association, have shown us that there's a way to bridge that. And where civil society definitely champion and rules the day is raising awareness. And I think this is something we can amplify and make sure it is coordinated in all the 4 pillars. So I'll stop here and bring it back to you, Dr. Maria. Thank you.
Thank you. Thank you, Adriana, very much. Let me now move to another part of the world. We move to Latin America. Sergio Sanchez, are you there? Sergio is a transport activist in LAC Civil Society. Sergio, ¿estás ahí? Hola, Sergio, buenas tardes. No te podemos oír. Please unmute. Ahora te oímos, pero apenas. A ver, habla otra vez. No. We can't hear you. Maybe if you, quítate los earphones, a ver qué pasa. Desconéctalos, no, no te oímos. Sorry, we can't hear you. We can see that you are talking because you are moving your mouth, but we can't hear you.
Can you hear me now?
Yes. You see, without the earphones, it's always better. Sergio, go ahead, please. Sergio, you can go ahead. No, you can't hear us, correct? Sergio, ¿me oyes ahora? We could hear you before. I don't know what you did. No, you can't hear us. Good. Okay, can I suggest that while Sergio look at the IT issues, what is he saying? Exactly, yeah, let's do that. Gillian, should I pass over to you? Gillian Holmes, she will take over here, but she's from the Cleaner Fund, a very strong partner as well, and she will conduct the next panel. So over to you, Gillian.
Okay, thank you. Delighted. I'm delighted to be here today to moderate a very quick discussion actually between the panelists, Maria and Nathan, hoping Sergio can join us and perhaps he can give his example of work on clean air after the panel discussion. As Maria said, I'm from the Clean Air Fund, which was set up in 2019. It's a philanthropic initiative, I suppose, funded by a wide range of foundations: Children's Investment Family Foundation, the IKEA Foundation, the Oak Foundation, Elmer Foundation, many of the Bloomberg Philanthropies, many of these you've heard. And we partner with governments, with city authorities, with UN bodies such as the WHO and CCAC, with a number of the civil society organizations that have been on the panel today. And we give funding for projects to tackle clean air. I mean, what we say we are on the tin. We work on air pollution, which we see as a major climate forcer, as Nathan has said, and a massive contributor to ill health, as Maria stated when she opened this session today. We work primarily in a number of what we call lighthouse geographies, those being the UK, Poland, Bulgaria, India, South Africa, Ghana, and we're working very closely at the moment with the European Union that is trying to bring through ambitious legislation, new air quality directives in line with the WHO guidelines, which, as we know, are aiming to bring down levels of air pollution worldwide. We partner with all these bodies to try and create a movement and action to clean our air. And it's been great this over lunch to hear these examples of really potent action from our civil society partners. I mean, I suspect like you were picking up common themes in their presentations. I mean, I heard, for example, they all seem to aim to harness youth energy and, as Maria said, youth passion, which was a very potent force for change. They all respond to the needs of local communities, responding to their demands for clean air. And I think they all seem to make the link between evidence and advocacy. I really like Tolu's words where she talked about the fact they use precision advocacy to achieve impact, and be that impact around the insertion of clean air as a right under the UN Convention for the Rights of the Child, which is fantastic news, or action on open waste burning, which Adriana talked about just now. Tolu mentioned when she spoke one of CAF's reports, the Clean Air Fund's reports last year, which was called From Pollution to Solution, which focused on, I suppose, quick wins or best buys in WHO's language around what we can do to clean the air as fast as possible. Well, another one of our flagship reports, which we publish every year, is the State of Global Air Quality Funding. And this tracks trends on funding for air pollution projects and for work on clean air. mean, one of the trends, a key trend, unfortunately, is the absence of funding from global health donors for any work on air pollution. Given the huge cause of morbidity and mortality, that is a huge surprise of us, and we want that to change. Now, we've seen some change this week. It's, I think, very heartening to all of us that there's been so much more focus on climate change and health and the intersections of climate change and health during this week's Health Assembly. And we all know that clean air action is climate action. So any investment in clean air action actually hits that dollar. But I want to use this opportunity of having the mic to ask our civil society partners, what would be their pitch or their advocacy to these donors? How can they motivate donors to put more money into tackling air pollution? So I'm hoping that the technology will work, and I can push this question first to Tolu. Tolu, what would be your pitch to funders like Wellcome, like the Rockefeller Foundation, like Bloomberg Philanthropy? Why should they invest their global dollar in work on advocacy and in supporting the kind of projects that you are implementing across Africa? Over to you, Tolu. 5 minutes, please.
Thanks, Gillian. I'm not sure it'll even take 5 minutes, but I think a couple of things come to mind. The first is recognizing the importance of atypical actors in coming together on this. I still think it's problematic that we still talk about advocacy separately from evidence, separately from practice, because this perpetuates silos. And part of our provocation, we're talking about precision activism, is recognizing that actually we need to think about evidence in ways that are in service to and not necessarily leading the way, but actually in service of the action that is needed. And once you start doing that, let me tell you, it gets very messy, right? And that's partly why I think it isn't done as much, because it gets messy. And I say messy I hold it messy in the highest regards, by the way, so it's a compliment, because they're different actors that need to play a role, right? So suddenly civil society is not just a nice to have to say, oh, we'll just do the research and then we'll let you know and you help us disseminate, but really in shaping and understand what the decisions, what is needed. The second is that, related to that, is that sometimes what we think is needed in terms of the next steps is not what transpires as we start to engage. So really the importance of recognizing that through transdisciplinary approaches, and by that I mean engaging academic, non-academic actors across different sectors and disciplines, for that to truly emerge, we can't have a very prescriptive linear approach to building that case for investing in clean air. So we have to create the space for unintended and unanticipated approaches and allow that pivoting to happen. And maybe the third thing I can think of right now is the importance of, when we talk about, and I say this every time I speak, right, where particularly on the African continent, we really have to front and center the majority demographic. I think the time is up, really, for thinking about youth as a nice to have engagement, it just doesn't make sense, right? My experience is that, there is just so much hunger and so much drive to be part of the solution, and we do ourselves a disservice when we simply pat ourselves on the back by engaging, quote unquote, youth towards the end and say, oh, look how good we are, we engaged the youth. Really, they have so much more to contribute. So again, thinking about how we can think differently about that, about doing that, and really pushing the boundaries of our methods, pushing the boundaries of who we engage, and pushing the boundaries of how we engage is really critical. And maybe just two last points. Sorry, my arithmetic is not adding up. I'm pretty sure I started with 2 and then said a lot more things. But the first is that bringing together information on air quality and health. This is, I spoke earlier about silos and health and climate. It's just something that is still really pervasive. The data on health lives very siloed from the data on air quality. And we heard from Dr. Kingston, and I presented it earlier, just really how powerful it is to understand, and even Elvis kind of mentioned in his personal experience, just how powerful it is when we understand what the health implications are. We're often dealing with very clear and present dangers in immediate things that have immediate and very much more obvious health impacts, but the hidden impacts of air pollution on health is something that we urgently have to tackle, and it is possible and it is doable, and we can't wait for. We need a much more strengthened health system to address this, but we can't wait to say, okay, we'll get the health system strengthened first and then we'll be able to bring that back, bring these two things together, which is why we need to think more innovatively about different ways to getting that information. And my last point really is on the citizen science approach, and in this work that I'm doing now, it reminds me a little bit about the, as a cautionary tale really, about the significant innovation that, again, was led from the African continent decades ago around community health workers, right? So in response to the HIV pandemic, we had this innovation around getting a new kind of workforce where we get people embedded in the communities to be part of building up the primary healthcare system. The problem is that we didn't sufficiently factor in them, community health workers, as being a cornerstone of the health system. And for far too long, and is still prevalent in a lot of cases, this is a voluntary thing. This is something that we recognize as being really important, but was not valued in the same way. It's just something you just have to do. Now, we know globally the impact of free labor, and that this is an often gendered experience where you have women much more contributing to unremunerated care. And I think about this all the time as we're building this participatory infrastructure. So I do think that if we're serious about building and opening up and creating the space for this majority demographic to be part of creating the solutions and to be a part of building these interventions for clean air, we do have to make sure that in so doing, we're not falling down the trap of the community health workers, and particularly in the context of high levels of unemployment and underemployment on the continent I work in. We need to think very innovatively. And so to the funders and to the kind of multilateral space, I do think we have to make sure that we are not repeating mistakes of the past, and that we're really responding to, and we're cognizant of the need and the potential of the majority demographic to, yes, be part of the solution, but we have to make sure that this is not an exploitative interaction.
Thanks so much. I mean, I really came through clearly. Putting evidence in service of advocacy, I think we'll all take that one away. And given the strong evidence that we have around air pollution as a massive killer, 7 million premature deaths, and a potent source of climate change, I think the case is already made. And with some of your precision advocacy, particularly from the huge demographic of young people across the globe, let's hope that there will be more funding flowing. I'm going to put the same question to you now, Elvis. What would your pitch be to global health donors to put more money into funding air pollution action on air pollution?
Thank you very much. This is a very interesting question and important. One thing we need to understand is that air pollution is a development issue in terms of the solutions, because when we look at air pollution, it's not perceived in the same way when we go around the world. If we look at Cameroon and Africa in particular, we will see that there is a big win. Development partners will gain a lot from investing in air pollution, which is contributing to the climate crisis. But we need to acknowledge that air pollution stands on its own as a problem. And when the solutions are being made, they have a benefit on the climate. And partners are so keen to the discussion of climate change, which is a good thing. But the way air pollution is perceived, and if action is not taken now, then the climate crisis we are going to be investing in, but not looking at the real issues. Air pollution is a real issue within the climate crisis. And once we recognize it as a development problem, and now we are solving the problem, identifying it as with solutions. Because the good thing, why do I insist that air pollution, bringing solutions to air pollution, it brings development, is because the solutions are there. Most of the solutions to tackle air pollution are there. I'll take, for example, clean energy. I was just like trying to say, if we acknowledge air pollution as the pandemic it is, and we decide to invest in Cameroon, for example, or in Africa, we decide to give free energy to 50 million homes, this is beneficiary, economic-wise, socially, and all whatnot. This to say that the model we use to approach development partners, because one thing is clear is that development partners get their money from business people. I've always classified life into 3 levels. We have the business people whom the think interest-wise, we have the government investing for everybody, we have civil society doing the watchdog. What actually happens is that civil society does not hold this money, but government has the power to influence companies, industries to invest this money in developing the societies where they live in. The one thing that has really shocked me about air pollution is that air is one of the free things we get. I don't know if we really think. When I travel around the world, like to the 7 countries, I've never really had anybody ask me, pay for the air you breathe. But if I want to drink water, I might probably buy it and so many of these things. So what actually happens is that the fact that air is free makes us feel so relaxed. But it should not be that way, because the air, one of our organs is the first organ that is directly linked to air we breathe, the lungs. Is the first organ which is directly exposed to the air we breathe. And we need to be careful about this, and we are just playing the hypocrisy. I say the image the world gives on air pollution is more of hypocrisy, because we live the reality, but we pretend as if it doesn't exist. And we need to approach development partners in the sense that they are living this reality of air pollution. They live in their daily lives, and they can make a change if they decide to do it for not themselves, but for the planet. Because the children, they are the ones who will be suffering, and they'll be talking the same talk in the next 50 years. Thank you.
Thank you so much, Elvis. And obviously, I really came again home loud and clear that air is a global public good, and we have to place a lot more value on keeping it clean. I think we're okay now, Maria, to bring in Sergio. I look at you.
Should we try?
Shall we try? Yes.
Sergio, ¿estás listo ahora? Can you hear us?
Can you hear me?
Fantástico. Sí, please go ahead. Sergio, tell us, we changed a little bit the program, but I'm sure that you want to tell us your experience in Latin American countries and transport.
Hello, my fellow air pollution terminators, and thank you for having me there with you remotely. And before speaking about EDF and Latin America, I also would like to...
Little bit louder, Sergio. Grita un poquito más.
Can you hear me?
Yes, perfect. Go ahead.
Excellent. So I also would like to share with you a little bit of my personal story about air pollution. I was born and raised in Mexico City, and in the late 60s, early 70s, air pollution was obvious, but there was no enough evidence that there was research that was pointing out that a problem was happening there. By the middle 80s, air pollution becomes even more obvious, and by then an air quality monitoring network was established. It was a state-of-the-art air quality monitoring network citywide. And we suddenly realized, the city, the government suddenly realized that not just air pollution was bad, but it was increasing in basically all pollutants, particulate matter, ozone, nitrogen oxides, lead, everything was bad and increasing. Then air pollution became a high political priority, and civil society came to express their voice to demand that actions to reduce air pollution was taken. As a result of that, there was a high-level political decision. The President of the Republic ordered the establishment of the first comprehensive-wide air pollution control program that was enacted in the late 80s, and it was started to be implemented in the early 90s. I was part of the team that put together the plan. Before, I was part of the civil society who raised their voice to do something about air pollution. We went to the streets, we demonstrated to request action, but finally the program was established, and it was not just a diagnosis, but it was a program that comprised a comprehensive approach in which actions to reduce air pollution from power plants, refineries, industrial sources, transportation started to be implemented. But to have a plan is not enough. There is a need to have institutions and institutional arrangements, multi-sectorial arrangements that enable this to happen. So the program started to work. Air pollution started to decline. It took many years to happen, but one of the lessons learned is that there's no a silver bullet. There's a need to take a comprehensive action. It's a long-term effort, and all institutions need to be aligned. And on the other side, society also needs to exert its pressure. In summary, in my personal experience, if you want to be successful to reduce air pollution, you need, among other things, three major things. One, a strong social advocacy based on evidence. You need also to have a strong political buy-in in order that can become not just a problem, but a solution, and decisions are being made to address the issue. And finally, be consistent and allocate enough resources that enable the cities, the countries, to address this issue. In Mexico City, we put in movement, we mobilized billions of dollars to address air pollution, but it took time. In other places, it has been possible also to do it and do it faster, much faster, as we are learning, as we can mobilize decisions, as we scale efforts, this can do even faster. So there is a need to scale and spread the good practices. We are not starting from scratch. There are very good and important efforts that have been done around the world. Unfortunately, not as many as we would like to get, but we need to learn from these past experiences and expand them. The possibility to have these connections all over the world in order to mobilize decisions and resources is clearly key to speed up the process. I work with Environmental Defense Fund since a little bit more than 3 years ago. Environmental Defense Fund is a global lead environmental organization that over the last more than 56 years has been working to make things happen. We have been working in different areas. We work on energy, oceans, biodiversity, health, and climate change. Now it's a cross-cutting issue that connects everything: health, climate, energy. And I would like to echo the words that for us, cleaner action is climate action. EDF has a global clean air initiative with specific projects in different parts of the world. The United States, we have projects in United Kingdom. Now we are working in Eastern Europe, China, India. We are starting to work also in Jakarta, and we have a special effort in Latin America that I am going to refer a little bit later. So in terms of social activism, let me tell you that, for example, in Oakland, EDF has been working with communities to expand the understanding of air pollution by introducing innovative technologies such as stationary and mobile sensing measurements. And this information has been very important to understand that there are some hotspots, some blind spots that regular air quality monitoring networks are not able to detect. So newer technologies, innovative technologies give us the power to understand better problems, but also solutions. And based on this information, we have been working to identify clean transportation solutions, what kind of measures can be taken to reduce emissions from industries, also supporting community-based monitoring, advocating for stronger regulations, and promote environmental justice and reducing air pollution in a way that benefits all the members of the community. Similar projects are happening in different parts of the United States, such as in Houston, in which we have a partnership with civil society organization and academic organizations called One Breath Partnership. Talking about Latin America, we recently launched a partnership with the Environmental Nations Environment Program to put in place a decision that was made by the ministers of environment from all over the region. In this partnership, we are focusing in helping UNEP to implement a regional action plan that includes objectives, strategies, and actions in order to strengthen regional cooperation all over the place for improving the way the problem is assessed, to increase capacities, to foster policy dialogue, and also to help the whole region to mobilize resources for not just local and national actions, but also to enable these regional-wide efforts. But we want to go beyond that. We recently have also joined CCAC and UNEP in order to identify what kind of project profiles all over the region in Latin America can be supported by technical assistance, by finance, in order to speed up the process by generating successful examples. We just recently met in Bogota, in a meeting, in a workshop, in which many representatives, the focal points of climate, clean air, and health from all over Latin America met together, and we identified a set of 14 high impact potential projects that joining efforts with international organizations, regional institutions, as well as the national and subnational governments, we would like to help to prepare further, to mobilize resources, and then support their implementation. We are in an early phase, but we are very hopeful that this effort can result in a major action, because we are not just focusing on developing these best cases, but also using these projects as a way also to spread and disseminate this effort all
Thank you,
around the world.
Sergio. Thank you very much. Did you finish with your presentation? Because we are going a little bit beyond time.
I just would like to close by saying that integrated air quality management is key. We cannot keep dealing with air pollution and climate in isolation. We need to have this integrated approach in which effective actions, high impact strategies that can address both air pollution and climate challenges simultaneously can lead at the same time to health and climate results. So thank you, and I really encourage all our fellows to keep working to defeat air pollution.
Thank you very much, Sergio. Thank you, perfect. I think over to you again, Gillian, or?
Well, I'm wondering now, given time, whether we might want to just open the floor to anybody in the audience who've got any questions for the panelists.
Great.
Do we need a roving mic? You have, okay.
Okay, so my name is Angela, and I am here representing the International Pharmaceutical Students Federation. So I have a question to any of the panelists. So I think what I can conclude from the session is that all of you mostly want to involve youth in the movement to achieve clean air and climate change. So my question is, like, first, how would you approach youth? And second, coming from a youth organization, in your opinion as experts, what are the actions that we can actually take from an organization or as youth in general to increase awareness, to provide more evidence, and to create tangible impact for the people around us, and to help other youth to take this action as well? Thank you very much.
Thank you. I'm wondering if we could actually ask our UN representatives here. I mean, we've heard a lot of examples from our civil society partners about how they're working with young people and really using young people as the engines of change. Can I ask you, Maria, how WHO can work more actively with young people, and then you, Nathan, perhaps?
Yeah, thank you, and thank you for the intervention. Yes, WHO has just created this new Youth Council. I'm sure that you are perfectly aware, and this is our kind of formal way to bring all of those groups with whom we have been working already in the past. In the case of climate change and health, you know that there is a big network. We had on Tuesday the opportunity to see all of our friends and NGOs and youth associations joining us in the evening on a little cocktail that we have to join forces there. There is a network, and I think it's definitely important that we had for the first time ever a youth representative on the climate change negotiation, the COP, OMNIA. And this is the way, I think on the case of the pharmaceutical groups, you have now an incredible role on what we are putting in place to reduce, to decarbonize the health system, because part of this decarbonization will come from the use of pharmaceuticals, the packaging, the plastic that is used, the environmental due diligence on the procurement. So all of these practices will give you a lot of influence on that. And of course, we need, more than asking us what we want you to do, I will turn the question to you and say what you guys can do to engage on this. What are your ideas on how to contribute to all of that? And I think it will be a fantastic collaboration. I don't know, Gillian, with...
Yes, perfect, thank you, great. Nathan, would you like to say, just describe a little bit how CCAC is engaging with young people?
So Thank you. So we work a little bit differently. We have a new youth strategy, actually, but it's going to be approved hopefully next Wednesday. So we haven't implemented it yet. In terms of actual engagement with youth organizations, it hasn't been something that we've actively done except through our partnership, and now we're going to pivot. So I would actually. Echo Maria and say, tell us what you need from us, but because we're here to serve you. But I also reflect a little bit on something that Elvis said. It's really quite striking. And one of a takeaway from this broader conversation, this has been a really meaningful and powerful series of presentations and dialogue that we're having right now. And I've made in the past, I have been I have not been very sanguine about a hyper-localized air pollution monitoring investment. As a scientist, I love data. I love playing with data, and any new data that I can get, I will take, right? But in the past, I haven't seen a lot of value in the data. For data's sake of monitoring air pollution, except in the service of creating change at a human level. And that's been, and we've heard some really powerful examples of how data has, hyper-localized air pollution monitoring data has been really quite transformative in mobilizing, particularly youth, for change. We work in the space of household energy. We have a household energy. We've been working in household energy for 12 years in the CCAC. We have a household energy hub where we are working with countries and communities to switch out traditional biomass cooking for LPG in some instances, hopefully all the way to induction heating and cooking as an endpoint. But one of the challenges that we've always run into, I promise I'm getting to a point here. One of the challenges we've always run into is that, and for me, I cook for my family. I have 3 children. Cooking is an act of love. It is an act of love that you are feeding and sustaining your family. And to find out that you are killing your family through this act of love, you are harming them, you are degrading their lives in some ways, is really quite painful. And to hear that from a UN agency is somewhat less effective than if you heard it from your child, actually. And so I was being a little cute, actually, in my opening. Like, there's never been more awareness of the impacts of air pollution. That is true. We've been using the 7 million premature deaths number for quite a long time. Everybody's heard it before. I'm not sure it's necessarily the number that's going to get us to the end it's going to get us to real transformative change. I think it's, we need to get past that number to the...
I do just need to go around the other panelists.
You do, I apologize. Yeah. We need to get to we need to arm the right advocates, particularly the youth, with the numbers that they need and the data and evidence that they need to transform their communities. So that's right.
Super. So I think that speaks again to precision advocacy. So I'm going to go quickly to Tolu and then Adriana. Then I'm going to take another question because I'm very conscious of time. Tolu, quickly, how do we respond to the demands of young people and work more actively with them?
Yeah, thank you. Just 2 things. I think one, just building on what the last point that you just made there, but actually taking a slight turn to say that not only think about equipping them with the data, but just giving them the tools to make their own data. And this is a fundamental approach that we take, because they can be part of generating the data, but not just data, but data stories, as we call it, needed to inform and augment and shape the cities that they live in for clean air. So that's the first thing. And the second is that we mustn't forget that even though we talk about civil society and the role of youth, that fundamentally government has a critical role to play. And so our approach in thinking about youth engagement and participation of the majority demographic is always with an eye on looking at how do we create and how do we expand that space to institutionalize the participatory mechanisms so that they can be part and parcel as a core part, not as a side part, but a core part of contributing to the decision-making processes that influence the air they breathe.
Wonderful. Thank you so much, Tolu. Adriana, anything to add?
Yes, I was just going to say, ironically, there's nothing like holding a youth summit to realize you're not youth. And sometimes I just wonder if we who are non-youth, we just don't need to get out of the way and let the youth get to it. And I say that because I'll give you a really nice example. I went to visit this company in Kenya. It is employing about 100 people, 100 youths directly and another 100 indirectly. And it started off as a youth association working together to recycle oil drums. And it's moved from that informal association to a small to medium-sized enterprise. So my question to them was, how can we connect them to a multinational private company that is generating waste, that is their input stream, for them to generate a profit and to provide a sustainable livelihoods to these hundreds of people. So I think my answer is we need to amplify these best practices that already exist on the continent, for example, scale it up, because good solutions can come from Africa to the northern region and elsewhere globally, and then sustain some of these solutions going forward to 2040 and 2063. Thank you.
Wonderful, thank you. So I'm going to ask for any other questions from the audience, and I'm going to bring in Elvis and Sergio in terms of answer. Front row, yes?
Thank you very much. So my name is Bronwyn King. I'm an Australian doctor, and I've spent the past 12 years working in tobacco control. But recently, in the past couple of years, I've taken a great interest in clean air, especially clean indoor air. And I just want to thank everybody for their presentations today. I think that they've just been full of really interesting practical insights and solutions. As someone who is sort of fairly new to the area of clean air, and I'm learning an awful lot, I've become a data boffin, and I love data, especially data that you can put in your bag and you can see, data that can go on an app and go straight in your pocket. And I find that data, in fact, has completely changed my behaviour. So armed with data and information has been fantastic. My question is, what advice would you give to people now looking at clean indoor air? Because clearly what we do for indoor air is going to depend very much on the conditions of the day outdoors. So I'm particularly interested in getting clean indoor air into schools, into aged care centres, into restaurants, into workplaces, because at the moment there's no indoor air quality standards, certainly not in Australia, but actually, except for I think Belgium, from the 1st of July, I don't think there's any country in the world that's got clean indoor air standards. So what advice would you give to me and other advocates who are emerging in the clean indoor air space? And secondly, how can we collaborate with you so that we can make sure that our solutions complement each other and that we really can leverage each other's expertise? Thank you.
Wonderful, thank you. Can I start with you then, Elvis? On this one?
Yeah, thank you very much. This is a very interesting question, which brings me to the previous question about how youths can engage more. You need to collaborate and think the actions both global and local. So sometimes we stay in our comfort zones and we think that everything will happen. You need to think local, global, and in the reverse process. So this just to add to that, because it plays a lot. That's where, when you think global, you need to think about WHO, UN. When you think local, you need to think about the national plans and the evidence. And youths need to know how this mechanism works. If not, your work is not consistent. So when you're a youth and you want to work, you need to think about collaboration, but you bring all these factors of really making the link on how the system, the system works from country to global. Your question really touches me. I used to be also a tobacco control advocate. I worked on tobacco control for more than 6 years, from 2013. So I actually left in 2019 to focus on air pollution and health. Your question is really interesting. Something which tobacco control advocates, they really make this link between air pollution and it. But I want to say something. I read a lot from both air pollution, tobacco. Smoke from tobacco is pollution. That's true. But for those of us who know how much has been invested in the WHO FCTC, what we are going to recognize is that Article 8 of the WHO FCTC focus on smoke-free laws. And smoke-free is actually taking into consideration what? Smoke from tobacco. You can't smoke in public places, in so many places. Like I will take in my context, that's where we had what? The smoke-free laws and all of that. And this just to say that the discussion around clean air pollution and tobacco is really interesting, but they are standing alone. Because when I take the WHO FCTC, they have done so much progress with the Article 8, which really outlines how people should not smoke in public places. And this is respected. Cameroon, where I come from, is very rare to see people smoking in places. Like you're afraid when you get into public. But this to say that when you want to engage in clean air, you need to know that there is something very technical between air pollution and tobacco. Tobacco is and used to be a product that has no use to human beings, be it indoors or outdoors. It has no use, to be sincere. If you don't smoke here, it doesn't change anything for you. But in air pollution, this is what the rhetoric changes. When you use maybe firewood for cooking, you use this for its daily life. You can't really stop people from burning firewood if they have to leave. If it's the only thing they have, then you need to help them by bringing in mitigation actions where you invest in actually bringing the clean energy, be it free or they paying it cheap. This is the language. Now, going outdoors, there are also vehicles. For example, in Cameroon, we use second-hand vehicles. It's a major source of our pollution in Cameroon, in Africa. How will you stop governments from investing, from bringing in second-hand vehicles? It's not even governments, it's the private sector. But the governments try to regulate this. It's difficult because the dynamics of politics. So this just to say that when you get into, the advice I'll give is that take air pollution as a very serious problem, but with its challenges, which can be managed because the solutions are there for air pollution. Like for example, air pollution, tobacco is more psychological at one point. Psychological, it means when you're addicted, it's difficult to bring you out. But when you're using a product which destroys you and you can do without, you can easily let it go through medication and education. Thank you very much.
Wonderful, thank you. Sergio, quickly, what are the quick steps that we can take to tackle indoor air pollution was the question.
Well, the first thing is to, can you hear me better?
Yes.
Excellent. Obviously, to understand the nature of the problem by not just measuring, but also the insight, but also the relationship to the overall emissions and the link to the source is very important. But I would like to add that it's not just the source of air pollution, but the causes that are put together in order to create this extensive use of biomass burning inside homes. So I would like to bring the perspective also of the social science, the need to strengthen the perspective of the social sciences to really understand what is the overall nature of the problem and look for better solutions. Obviously, just the replacement of cookstoves hasn't worked very well. It really needs a more integrated approach. And let me just use this chance to address the previous question. For me, one of the most important things that institutions, international organizations can do is to really educate or help to educate more. There's not enough education. And it doesn't need necessarily to restrict to science, but to care, not just education for knowing, but education for caring. We can have the better data. We can know that almost 10 million people die a year, and that's 100 million people dying in a decade. And it won't happen everything if the system of values, if the necessity of caring about each other, particularly the ones that are more vulnerable, if we don't care about that, it's really worthless. So I think that's one of the major issues that have to be taken. And I also think that amplifying these local voices is extremely important to make the change happen.
Thank you so much. I'm noticing the time now. We're 3 o'clock already, so I fear I'm going to have to close the panel discussion, which was just so stimulating, and hand back to you, Maria.
Thank you, Gillian. You did so well. Thank you, and you have been very good on keeping the time and all of that, much better than me, probably. I needed the assistant on Elaine on telling me that it was not okay. Thank you, all the panelists. It has been lovely. It would be better to see you here because it will be a great occasion to exchange and to celebrate. A lot of things are happening at the World Health Assembly, and I'm sure that many of you need to go back. At least I have to go back very quickly. But before that, there will be my privilege to close with a microphone from my end, and you will have the closing remarks. Is that okay? Is that okay with you? But let me ask the people before they leave, are you considering yourself now pollution terminators? Who among you? Please, yes? All of you pollution terminators? Okay, we did something good here. So thank you so much. Over to you. Thanks.
Thank you. Yeah. So as I said, brevity is not one of my weaknesses. I'll try to be as fast as possible. I don't think I completed my last thought, my last intervention, and maybe that's, let me close the loop. Maybe that's a good way to finish this. You have to, you have to combat, you have to make a change, and you need to bring love. You need to combat love with love. You need to arm the people that you love and are hurting with the tools and the knowledge, not just the tools, but actually the knowledge of how to make a change, right? And I think that's something that came out of everyone's presentations today. It's been really quite powerful, and I'm glad that everybody's a pollution terminator now. We need to arm people with data, the right advocacy tools to make a change, and not only that, you have to actually give them the solutions to make the change. And if you can do that, you could be really quite transformative. I know the focus here is on youth, but I would advocate that every person who breathes has a role to play in this, from infants all the way up to the retired folks in their dotage. We all have a role to play. We need to work together on this. Let's all be terminators together. Thank you.